Imagine a perfect summer day. The sun is shining, a family swims in a sunlit lake, a moment of pure joy. But what if I told you a microscopic predator could be lurking? It's a terrifying thought, but it's real. This isn't a monster from a horror movie, it's a single-celled organism with devastating capability, often called the brain-eating amoeba. Infections are incredibly rare, but consequences are almost always fatal. This hidden danger is known as Naegleria fowleri. It's thermophilic. It loves heat. So let's break down exactly what this organism is. Naegleria fowleri is a free-living amoeba, a single-celled life form you can only see with a microscope. It is not a bacterium or a virus. It is a eukaryote with complex cell structure. It normally lives at the bottom of warm, freshwater bodies feeding on bacteria in mud and sediment. It has a three-stage life cycle: cyst, trophozoite, flagellate. The trophozoite is the infective, feeding and reproducing form. When it reaches the brain, it releases powerful enzymes that dissolve brain cells. It liquefies and consumes cellular debris, causing massive inflammation and swelling. Naegleria fowleri is naturally occurring and found worldwide, most commonly in warm fresh water. It cannot survive in salt water or properly chlorinated pools, but lives in lakes, rivers, hot springs, and even poorly maintained pools. How does someone get infected? You cannot get infected by drinking contaminated water. Stomach acid destroys it. The real danger is the nose. Infection occurs when water containing the amoeba is forcefully pushed up the nasal passages. Diving, dunking, water skiing, wakeboarding, any forceful water entry. Another route is nasal rinsing with contaminated tap water, for example, neti pots or sinus rinses. Always use sterile, distilled or previously boiled water for any nasal rinsing. Once inside the nasal cavity, the amoeba travels up the olfactory nerve, a direct highway to the brain through the cribriform plate. It bypasses major immune defenses, reaching brain tissue quickly. Risk is highest in warm, stagnant or slow-moving waters, lakes, ponds, shallow river bends and hot springs. Temperatures above about 80 degrees Fahrenheit, 26 degrees Celsius, favor its growth. Importantly, PAM is not contagious. You can't catch it from another person. It is an environmental, rare accident. Know the risky activities and you can avoid them. One of the most heartbreaking aspects of PAM is how difficult it is to diagnose. Initial symptoms mimic common illnesses: severe headache, fever, nausea, vomiting, so doctors often treat for bacterial meningitis first. That initial logical response consumes precious time the patient doesn't have. The gold standard is a spinal tap to collect cerebrospinal fluid for analysis. CSF in PAM typically shows high white blood cells, mostly neutrophils, low glucose and high protein. Occasionally motile trophozoites are seen on wet mount. PCR testing is the most accurate but takes time. Immunofluorescence and antigen testing exist too. Seeing live amoebas requires specific expertise. They are easily missed. Tragically, PAM is sometimes only confirmed at autopsy. Its rarity means many clinicians will never see a case, further delaying suspicion. A key to earlier diagnosis is patient history. Recent warm freshwater exposure must be communicated to clinicians immediately. If clinicians consider PAM earlier, specific tests and aggressive therapy can begin sooner. Every hour counts. Symptoms begin 1 to 9 days after exposure, the average about 5 days. Early symptoms mimic bacterial meningitis: severe headache, fever, nausea and vomiting, stiff neck. Within 1 to 2 days, infection progresses to severe neurological symptoms. Brain tissue destruction and inflammation become apparent on imaging. Patients may become confused, lose balance, suffer personality changes as the frontal lobes are attacked. As swelling and pressure increase, hallucinations and seizures often occur. Patients may slip into coma. Death typically occurs within about 5 days of symptom onset. The move from what seems like a bad flu to catastrophic neurological failure can happen in less than a week. Recognizing rapid escalation and seeking immediate care is vital. Early action can be the difference between life and death. Treating primary amoebic meningoencephalitis is an incredibly difficult challenge, and sadly, it is rarely successful. The lethality rate is over 97%. The core drug is amphotericin B, given IV and sometimes intrathecally. Miltefosine, an investigational drug, has been used in recent U.S. survival cases. Other agents sometimes used in combination include rifampin, azithromycin, and fluconazole. Steroids like dexamethasone and aggressive measures to control cerebral edema are also employed. Treatments can be invasive: intrathecal injections, induced medical coma, therapeutic hypothermia, all with significant risk. Only a handful of documented survivors, often diagnosed and treated very early and with multi-drug regimens. Even survivors can face long recoveries and permanent neurological damage. Because treatment is rarely successful, prevention must be our primary strategy. Public health agencies hold emergency drugs and issue advisories. Awareness saves time and lives. Given the devastating nature of PAM, prevention is the most effective strategy. You can take simple, practical steps to reduce your risk. The most important rule: avoid water going up your nose. Keep your head above water, use nose clips, and avoid forceful dunking. Don't stir up sediment. The amoeba lives in mud and silt. Heed posted water quality advisories and stay out of roped-off areas. For nasal rinses, use sterile or distilled water, store-bought sterile saline or previously boiled and cooled water. Maintain your hot water heater at least 120 degrees Fahrenheit, 49 degrees Celsius, to reduce risk in plumbing. Together, avoiding water up the nose, using safe water for rinses, and maintaining heaters, create layers of protection. These simple steps let you enjoy summer safely. Vigilance after swimming in warm fresh water is key. Remember, symptoms typically appear within 1 to 9 days after exposure. Sudden and severe headache, fever, nausea and vomiting, a stiff neck, inability to touch chin to chest, is a red flag. If these symptoms appear after freshwater exposure, seek emergency care immediately and tell staff where and when you swam. That history can prompt rapid spinal tap and specific tests for Naegleria fowleri. Do not adopt a wait-and-see approach. Every hour counts. Acting decisively and communicating clearly with providers gives the only chance to begin aggressive, life-saving therapy. The story of the brain-eating amoeba is terrifying, but knowledge is our best tool. Recap: thrives in warm, fresh water. Infects when contaminated water is forced up the nose. Swallowing does not infect you. It is not contagious. Hold your nose, use nose clips, avoid stirring sediment and use sterile water for nasal rinses. Turn fear into informed action. Enjoy the water, but be smart. Be well. Today we're going to explore one of the most important health topics of our time: AIDS, or acquired immunodeficiency syndrome, and its relationship with HIV. AIDS is the most advanced stage of HIV infection. HIV attacks the body's immune system. Specifically, it targets CD4 cells, also known as T cells, which help fight off infections. When HIV severely damages the immune system, the person develops AIDS. Early HIV infection often appears as flu-like symptoms 2 to 4 weeks after infection. These include fever, sore throat, fatigue, rash, swollen lymph nodes, headache, and muscle aches. As HIV progresses to AIDS, symptoms become more severe and persistent. These include rapid weight loss, recurring fever, extreme fatigue, and opportunistic infections. HIV is transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk. The main modes include unprotected sex, sharing needles, mother-to-child transmission, and blood transfusions. Once inside the body, HIV targets CD4 cells, uses them to replicate itself, then destroys these cells, weakening the immune system progressively. HIV diagnosis involves several types of tests, starting with antibody and antigen tests. These detect antibodies or P24 antigen in blood, with results in minutes to days. CD4 cell counts help determine disease progression. Normal levels are 500 to 1600 cells per cubic millimeter. Prevention includes behavioral strategies like using condoms correctly every time during sex. Limiting sexual partners, getting tested regularly, and avoiding needle sharing are crucial. Medical prevention includes PrEP, a daily pill that reduces infection risk by up to 99%. PrEP provides emergency protection within 72 hours of exposure, and treatment as prevention means undetectable equals untransmittable. Antiretroviral therapy, or ART, is a lifelong treatment using combination drugs. ART suppresses the virus to undetectable levels, allowing people with HIV to live long, healthy lives. While there's no cure yet, research continues for vaccines and potential cures. Some functional remission cases give hope, though they remain very rare. Remember, early symptoms can be flu-like, diagnosis involves multiple tests, transmission occurs through specific body fluids, prevention is highly effective with proper precautions, and treatment allows people with HIV to live normal lifespans. If you have concerns, consult healthcare professionals and get tested. Knowledge and early action save lives. Stay informed, stay protected, and support those affected by HIV and AIDS.